Thank you so much for having me. It's wonderful to see so many people here. 2 years ago, started looking for funding to do a research project on grief and dementia. And we were very lucky to have Alzheimer's Society Canada fund us for 2 years to do research into what kinds of supports might be helpful for family caregivers providing care to someone with a dementia around grief, because this was an area that was really understudied. And the principal investigators were Dr. Penny McCourt and Dr. Holly Tuco, and my role in this was around developing the education tools that the research supported. We really looked at the area of grief, but the kind of grief that caregivers usually experience when they're looking after someone with a dementia. And there was a lot of interest in this topic of disenfranchised grief by Dr. Kenneth Doka. And he looked at disenfranchised grief in a whole lot of different areas. But what we were interested in was disenfranchised grief and caring for someone with dementia. And really what that means is that it's a grief that a person experiences that it really cannot be openly acknowledged, publicly mourned, or socially supported. There are no rituals that caregivers go through as they experience the grief and the many losses of the person that they're caring for with dementia. So it's really a loss that's not appreciated by others. And you know, it's not that families or friends or healthcare providers don't appreciate that there are some losses, but what they don't understand is that the losses are many and they're experienced all along the journey of the dementia disorder. So there are transitions of grief that happen with every loss that is experienced by the caregiver and by the person with dementia. And that is where disenfranchised grief comes in, because sometimes, okay, we've talked about it, we know you're sad, all right, now here's some of the practical things that you can do in the home. These are the things that you can do to manage. These are the things that you can go through day by day. What wasn't happening, unfortunately, is that there wasn't a real acknowledgement from health support and healthcare providers that the grief is ongoing. So if the dementia journey with your loved one is 20 years, you will have transitions of grief throughout that 20 years. And grief does not stop when the person is eventually at a point, as you said, when the person goes into placement. There's actually a huge upsurgence of grief at that time that is not well understood by healthcare providers in facilities. And a lot of the education that we have developed through this research has also been for healthcare providers so that they understand how they can be more supportive. So when is grief disenfranchised? When the relationship, the loss, or the griever is not recognized. Caregiver grief is often associated with a decline in physical health, a decline in emotional health. It's not well understood, not just by healthcare providers, but it's not well understood by caregivers themselves, and often not acknowledged by caregivers themselves. It often comes across as fatigue, maybe frustration, maybe anger, maybe isolating themselves or withdrawal. But it's not often talked about. I've had a loss, I'm grieving this loss, I need to talk about it. And it occurs because of the progression of the losses in dementia. There's not just one loss, there's losses that are compounded, again, as I said, that go along the dementia journey. And unresolved grief, grief that you're not able to express, that you're not able to, from time to time, sit down and talk about, intensifies and adds incredibly to the emotional burden of caregiving. We did this study because we wanted to find an effective way of letting healthcare providers know that this was important, this was an issue for caregivers, and we also wanted to develop education and tools for caregivers themselves. And we wanted to make it accessible. We're on Vancouver Island, and there's some places on the island you can only get to by float plane or boat. And both Lori and I have worked in outreach services and have gone by boat and float plane to places. So we wanted it accessible. But when you're doing research, it's really tied to accessibility, and it's tied to cost effectiveness, these types of things. So we wanted to be able to provide this in different types of ways. We wanted to look at the levels of grief. We wanted to look at how we could empower caregivers, how we could help them cope, and how we can help them sustain that through creating some resilience. So what we did in the study is that we presented the information 5 ways. We did it individually, face-to-face, so we would meet with caregivers on one-to-one. We would go through the different materials that we developed. We would go through the support process. We would do by telephone. There's people up in Bella Bella that we would just call once a week by phone and offer this support that way. We did groups, which is what you're going to see in the DVD I'm going to show. We did actually a group phone, which was the first time we had ever done that. And we did online group because there are a lot of people now who are using the computer. But the interesting thing about offering it all 5 ways was it didn't, in the study itself, what we were able to show is it didn't matter which way or which approach that we offered, they were all helpful. There was no one approach that was any more helpful than the other. And I think that probably speaks a lot to the actual materials, the education materials that were developed, because they are practical, they're user-friendly, and they can be used by the person themselves or in a combination with the healthcare provider. So each presentation, each session had a presentation, some information and discussion, a lot of exploration around grief and loss issues, and the caregiving experience itself. Again, there are a lot of really good support groups. There's really good information, especially by the Alzheimer's Society in BC. But where we found there was very little in terms of support was around the experience of the caregivers themselves. What were they experiencing and what were their losses? And we were able to identify tools and strategies that would really help support caregivers. The results of this study from the actual support that we provided, they found, of course, that there was a real benefit in sharing, either just sharing with the healthcare provider, sharing with other people. They certainly gained a lot of personal insight, were able to actually identify that they were grieving and, sort of name it for themselves, which was really, really important for them to be able to start working through that grief. And then again, recognize when it started to rear up again as their journey with dementia caregiving continued. They found that they were able to really benefit from the strategies that were developed through the research that we gave them in working through their grief. And they also had a better understanding of the person's experience who had the dementia disorder. They gained emotional mastery, to understand exactly what it was that they were feeling, to be able to name it and to be able to address it. They were also able to identify personal boundaries, which was really important in terms of recognizing when they'd had too much, when they needed to get out, when they needed to have a bit of fun in their lives, and they were able to plan better for the future. The resources that we developed from the research that are available to the general public, available to healthcare providers, was a DVD for providers and caregivers, a workbook for caregivers, and also a guide for healthcare professionals in terms of some of the supports and resources that they can develop. The other thing that we did as part of this study was we looked at cost effectiveness. As you all know, health authorities are very much into how much things cost, and we were able to show there was a really good cost benefit no matter what approach that we used. So on Vancouver Island, we are offering this in the Victoria area, in the southern island. We're offering it in Central Island, and we're going to be offering it in the north part of the island. We have formal support groups, and all of the care providers within Seniors Health have access to these tools so that they can support families. And they use them in lots of different ways. One example was one of the biggest issues for a lady after she'd sort of acknowledged her grief and worked with the healthcare provider was she said that she just couldn't get her children to understand what was happening. They would phone the house and they'd say, oh, Dad's okay, Mom. He's not that bad. He can talk to me. He can carry on a conversation. So what she decided to do is she took a copy of the DVD home and she brought all her children and their spouses together and she sat them down and she made them watch it. And when she came back the next week to the healthcare provider, she was so relieved because she said, now we're all finally on the same page. She had spent so much time trying to explain to her children. She realized how emotionally draining that was for her.